Hey everyone, let's talk about something more interesting related to heart. Now, in the last session, we discussed that exactly how the blood flows through the heart and what is the structure of heart. Now, the question which comes to my mind is exactly how the blood gets into right ventricle, then goes into the left ventricle, right ventricle, and how the pumping exactly takes place. So it is said that the pumping of the heart is because of alternate contraction and relaxation of the muscles of the heart. So it is said that the heart is made up of a special type of muscle said to be cardiac muscle, which contracts and relax alternatively, rhythmically. Okay, how rhythmically, that we are going to discuss. This contraction and relaxation leads to the flow of blood through the heart and exactly the pumping of the heart. This contraction of heart is said to be systole, whereas relaxation of the heart is said to be diastole. Okay, contraction of the heart is said to be systole. Contracting means getting smaller in size, and relaxing means coming back to the original size. So contraction is basically systole, whereas relaxation is diastole. One heartbeat is said to be one cardiac cycle. Okay, one heartbeat lasts for 0.8 seconds. So in 1 minute, a person beats for 72 times per minute. Okay, please remember one heartbeat. What is one heartbeat, that we are going to study, but one heartbeat lasts for 0.8 seconds, and accordingly a healthy adult human being has heart rate of 72 times per minute. What is heart rate? The number of heartbeats in a minute. So a normal human has a heart rate of 72 times per minute. Now, this cardiac cycle has some seconds which you have to remember. So I remember is I hate or I you hate. Okay, I hate you, basically I you hate. So I is 0.1. Since it is one letter, it is 0.1 second. U is 3 letters, it is 0.3 seconds, and hate is 4 letters, so 0.4 seconds. Let's see what is for 0.1 second, what is for 0.3 seconds, and what is for 0.4 seconds. Okay, now it is said that when the heart starts functioning, first what happens is the atrium, the upper chambers of the heart contracts. Means what? The auricular systole happen. Why auricular systole? Auricle is another name for atrium and systole is contraction. So the first thing which happens in your heartbeat is auricular systole, which lasts only for 0.1 second. And yes, you are right here. Both the auricles will contract. The deoxygenated blood from the right atrium will go into the right ventricle, whereas the oxygenated blood from the left atrium will go into the left ventricle simultaneously. Okay, it is not that first the deoxygenated blood will go to the lungs and then the oxygenated blood will go all parts of the body. No, it is happening simultaneously. The first thing which happens in your heartbeat is auricular systole, or you can write in general language, in your language, atrium contraction. So suppose this is your heart, right? So this upper parts 1 and 2 will contract simultaneously and the blood will flow into the lower parts. This happens only for 0.1 second. Secondly, what will happen if they contract? The blood will come down because they are reducing in size, and hence the blood starts filling into the ventricles. Now, common sense, again, what will happen? The ventricles will contract. Hence, the second thing which happens in your heartbeat is ventricular systole, which lasts for 0.3 seconds. What will happen in ventricular systole? Ventricle systole means contraction, and when they contract the blood from the right atrium, right ventricle, and this is left ventricle. So the blood from the right ventricle will go to lungs. and the blood from the left ventricle will go to all parts of your body. Okay, so during articular systole, the blood comes to ventricle. During ventricular systole, the blood goes to lungs and all parts of your body. And finally, for 0.4 seconds, all the four parts relax. There is blood coming from the superior and inferior vena cava to your atrium. So this relaxation is said to be diastole, that is complete cardiac relaxation. All the four chambers have contracted. They have to relax. They have to come back to original position. Then only the blood will get filled and again they will contract and the heartbeat will continue. So what happens for longer time? The relaxation happens for longer time. Like as we also relax after doing a physical exercise or after carrying out our daily chores. Okay, hence in the same way, once the blood has been pumped by by atriums and ventricles, they have to relax, and this relaxation is for longer time, and it is said to be diastolic or cardiac diastole, and it lasts for 0.4 seconds, and in this 0.8 seconds one heartbeat gets complete. So if anyone asks you what is one heartbeat, you will say articular systole, ventricular systole, and relaxation of all the four chambers is said to be one heartbeat. Okay, and this was also known as cardiac cycle. Okay, here the doctor feels your heartbeat by an instrument known as stethoscope. We all are very well aware of this instrument. There is a earpiece the doctor puts into his ears and one chest piece which he keeps on the patient's chest to check whether everything is proper. Okay, and there is a tube which will give the sound of the heartbeat to the doctor. Okay, so how can you listen to your heartbeat? By an instrument that is said to be stethoscope. And what is the stethoscope? Why it is used? Why the doctor cannot keep his ear near to the heart and ear? Because the sound coming by the heart during the heartbeat is very low. Hence this instrument is used to amplify the sound. Amplify means basically increase the volume. We use amplifiers in DJs and all. Why? To increase the volume. In the same way, the heartbeat has to be increased so that the doctor can hear it clearly whether the heart is beating for 72 times per minute, and hence he uses this instrument that is said to be stethoscope. That's all about heart. If you have any doubt, you can write in the comment section. Please do like, subscribe my channel. Thank you so much.